Compression stockings. They can be so awesome for dealing with swelling, especially in the lower extremities. I'm talking about the legs, the ankles, etc. Compression hose or compression stockings come in a variety of strengths. They're often found in different types of environments. They can be obtained via prescription. Sometimes they're found over the counter. I'll do a separate video on compression stockings in general because sometimes they're a little tricky to put on, and you want to be thoughtful about the strength, meaning the amount of compression that you have. But keep in mind that compression stockings can be amazing for dealing with lower extremity swelling or edema. Swelling, edema, I'm using the terms interchangeably. So if your doctor has recommended them or someone suggested them, seriously give that some thought. Obviously, you want to get your doctor's suggestion and advice, but compression hose, compression stockings can be awesome. I know sometimes it's tough in warmer months to wear them, but there are ways around this. Just keep that in mind. Guys, I'm Dr. Jen Caudle. It's good to see you. We are talking about how to get rid of swelling, lower extremity swelling. I'm going to give you 4 tips, okay, that are really important. Before I give you the remaining 3, let me just tell you, I have other videos on swelling, medications that can cause swelling. Amlodipine can do it, by the way. I have a video on that. Lower extremity swelling in general, I have a video on lymphedema. I'll make sure I link them here. For those of you watching on Facebook, if you don't see the link videos, because you won't, it's usually only on YouTube, DM me and I will send you which video you're interested in. Okay, my point to saying all this though is that I've got to say this first. There's a lot of potential underlying causes for swelling. I would be remiss if I just give you 4 tips for getting rid of swelling, but I don't give you the full picture, which is that the biggest way and the most important way that we get rid of swelling is we deal with the underlying cause, okay? The underlying cause can be a ton of different things, from kidney disease, liver disease, heart disease, lung disease, pregnancy, this and that, other types of things. Now, keep in mind, things like pregnancy and menstrual periods and stuff like that, you can't get rid of that, right? So sometimes we can't deal with the underlying cause. But when I say the underlying cause, the other thing I want to caution you all about is this. You always want to get a diagnosis and you want to have your swelling evaluated. Why do I say that? I say that because, lower extremity DVTs, deep vein thromboses, can present as swelling in your leg. Now, generally that is unilateral, meaning one leg and not both. But the point here is I don't want to just give you a false sense of security that, oh, just go and do these things without talking to your doctor, because there could be very serious causes of your swelling that you will miss if you treat it on your own. So talk to your doctor and get a diagnosis. Okay, now that we got that out of the way, let me go back to some other awesome tips to help, okay? The next thing, we talked about compression hose. Elevating your legs, so important, can help for a lot of different underlying causes of swelling. So you're probably saying, well, how much do I elevate my legs? How long? This is according to Up to Date, which is a medical source that I and many of my colleagues often use. You want to try to elevate your legs above heart level. So like if you're laying down or you're reclining or whatever, get some pillows, prop your leg up, things like that. You can do even when you're watching TV, etc. Try, if you can, to get it above heart level for about 30 minutes. You can do this 3 to 4 times per day, okay? This, again, is according to Up to Date. But elevating your legs often helps with many different types of swelling that we have in the lower extremity, okay? The next thing I would say is that along with this idea of going to see your doctor, another reason to see your doctor in addition to getting a proper diagnosis is because sometimes you may need actual medications or diuretics to get rid of the swelling in your legs. What's a diuretic? It's a pill. We call them water pills, if you've ever heard of that. It's a medication that causes your kidneys to excrete sodium and water. We use diuretics for multiple things, heart conditions, blood pressures, etc. Sometimes swelling, depending, okay, underlying conditions. So you may qualify for a medication. Another reason not to just be treating this on your own by yourself at home, okay? So keep that in mind. And I would say the last thing that I wanted to mention that is very, very important is maintaining a low salt diet, okay? We want to have a low salt diet for so many different reasons, to keep our blood pressure in check, for cardiovascular health in general, and so many other things. But it often helps with keeping swelling or leg swelling, edema in check as well. So that low salt diet is important. And this is one thing I'll say about a low salt diet. A lot of people say to me, like my patients will be like, well, Dr. Jen, I don't use a salt shaker. Like I don't even use salt on my food. a lot of times in my experience, it's not necessarily the salt shaker that's the problem. It's the types of foods that we're eating. They are foods often that are prepared or packaged or preserved. They're foods that we're buying at restaurants. They're frozen foods, whatever. And so they often require a higher salt content, in part probably to preserve them, in part because they're made and, you know, they're not made in your kitchen, etc. So that actually contributes. Okay, so you may not be using the salt shaker. You just may be eating out a lot, and that could be doing it. So keep that in mind. Guys, remember, the most important thing is to get a proper diagnosis, get it evaluated, make sure there's nothing dangerous going on. But these 4 tips often help with many different forms of swelling. Let me know what you do for swelling if you haven't, what your doctor has diagnosed you with. If you're comfortable sharing it, share this video with other people. I'm hoping it will help others. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on Facebook. Please like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. I'm on TikTok and WhatsApp and Instagram, etc. Please follow me there. Okay, I would love to see you. And then sign up for my free health newsletter. I do go to my website, www.drjencaudle.com, where you can sign up for my free health newsletter. I send it out every week where you get these videos in case you miss something. All right, guys, love y'all. Bye.